era of healthcare is dawning around the country.
I'm loved that I have a job that I can give. The J-CHiP program is a wonderful opportunity for community members to be there for a community.
As prevention becomes as important as treatment, new paradigms are emerging. The Johns Hopkins Community Health Partnership is building new workflows and new partnerships to protect the health of the people it serves, inside the hospital and in its surrounding neighborhoods. For healthcare in the US, the writing was on the wall decades ago. Costs were soaring, reaching as much as 18% of GDP. Populations were aging with complex and coexisting diseases. Expenditure waste was being estimated at 20 to 50%.
I think that it became clear to physician groups and policymakers in the 1980s when the healthcare costs started to skyrocket, and it became obvious that providing care for patients with chronic illness was not sustainable into the future. Models became developed that demonstrated that not only could you provide better care with better outcomes for patients, but also more cost-effective care.
The Johns Hopkins Community Health Partnership is one of those models of transformed healthcare. By building on existing strengths like multidisciplinary team workflows, strong relationships with the community, we are answering the question, how can our communities get healthier affordably?
This is an ambitious project, one we hope will be a model for the nation. With a grant from CMS, we set about improving the health of people in neighborhoods surrounding Johns Hopkins Hospital and Bayview Medical Center.
At the heart of this model is the ability to identify patients at risk, either in the hospital or in the community, and to deploy interventions to help mitigate that risk.
All of us who receive health care, at one point or another, see a lot of different doctors, primary care physicians, and we end up having different diagnostic tests, and we worry that our doctors don't speak to each other, that they perhaps don't see all of the information about our clinical care. One of the accomplishments of J-CHiP will make sure that there is full integration in how providers communicate, how they have access to all the information, and this influences the patient's journey.
J-CHiP in the inpatient setting has really helped us shine a light on the importance of multidisciplinary communication.
J-CHiP has become part of the day-to-day language in transition planning. Patients who are at risk for readmission are evaluated for referral to J-CHiP services, and other strategies are put in place to prevent their readmission.
A key strategy in supporting our patients is education. In some cases, traditional roles have been expanded.
The J-CHiP program has kind of really defined our role in relation to direct patient care, so we do a lot more medication reconciliation.
I have a tendency sometimes, to think I'm doing my medications right, and then later down the road, I find out that I'm not.
You're going to take the 200 milligram tablet just once a day. Okay. If there's a new medication that the patient's going home with, we'll take the time to come to their room and educate them on that medication. When they go home, we'll follow up with them to make sure they're taking their medication appropriately and they're adherent to that medication. Research has showed us that medication non-adherence is a big driver for hospital readmissions.
To get all of the information to the patient when they need it most, the partnership created new positions, including transition guides, who bridge the gap between hospital discharge and home.
The hospital can be very overwhelming for patients, and transitioning home can be even more so because they're worried about their jobs, they don't feel well. So I'm able to go in on a one-on-one basis and focus on education, have them better understand their illness, offer additional community support services.
With J-CHiP, we meet on a weekly basis. We meet the case managers face-to-face and talk about ways that we can help the patients.
Case managers are not only just in the clinic setting, we also go out in the community to help find patients that haven't been in for regular medical follow-up.
As important as a person's medical treatment is, so are their emotional, psychological, and behavioral needs. Things like their smoking, overeating, and we work with them to help them address those issues so they can be well.
So much of the real healing happens outside the hospital walls, within the patient's home community.
The role of the community collaboration with J-CHiP is critical because we bring the intimacy to the relationship that promotes the healing. There is a change in the air around healthcare. We are the trusted voice in community, and so therefore we bring the hope, we bring the healing, and we bring the health differently, that brings about compliance, that brings about resource identification.
It's actually working because it's bringing amazing numbers to the Men and Family Center and Charm City Clinic, and people are signing up for the first time because they know now that they have a right to health care.
We're really excited about the Community Health Partnership. This has just helped to bring all of those efforts together, to solidify those efforts, and what we do have most importantly is our people, because we really do have a great group of big idea people to help us in moving this forward.
Since coming to Hopkins, I really feel empowered and becoming very proactive in my health care. Just great care. I really felt like, okay, you know, I can really do this, whatever my heart condition is, I can do this with a good team.